Hello, I'm Keith Howard, and I'm the coordinator of the Healthy Communities Initiative of Jefferson County. HCI exists to address three areas of health care in our community: promoting healthy lifestyles, addressing substance abuse, and promoting mental health awareness. We do this with several community members and organizational partners. We welcome you to this presentation of Building a Resilient Jefferson County, the Adverse Childhood Experiences 101. We hope that you will share this presentation with your friends, neighbors, and coworkers. As our team has worked to identify ways to make our community healthier, we came across the concept of adverse childhood experiences, often referred to as ACEs. ACEs grew out of the Kaiser Permanente study conducted by Drs. Felitti and Anda. The study was conducted in a suburban California community. What struck these researchers is that the problem of adverse childhood experiences was occurring among middle-class patients. If this was occurring in an educated middle-class community, what was the impact of persons who did not have access to health care or a good education or grew up in a less stable environment? Since then, this study's been replicated many times in many types of communities. What are ACEs? There are 10 ACEs, and they fall into three main categories: abuse, which includes physical, emotional, and sexual; neglect, which includes physical and emotional; and household dysfunction, which includes mental illness, incarcerated relative, mother treated violently, substance abuse, and divorce. ACEs are further compounded by the community environment. If you live in a community or neighborhood with poor housing, violence, and lack of upward mobility, this makes a child's life even more complicated because there's likely to be a lack of support to combat the ACEs experienced in the household. What impact do ACEs have? Dr. Felitti became interested in this idea because he was treating patients for obesity. He would have patients that would be making progress in overcoming their disease, but would relapse without any explanation. In the Kaiser Permanente study, researchers discovered that the more ACEs one had, the greater the health risks, as shown in this chart. These adverse experiences from childhood can impact our health as we become adults. Many of these come from living a risky lifestyle, leading to such things as broken bones, depression, suicide, unplanned pregnancy, HIV or STDs, cancer, diabetes, alcohol or drug abuse, lower education, or jobs resulting in lower incomes. This slide again shows the increased health risks of breaking it down between those that are behavior related and physical or mental health related. As you look at this chart, you can start to understand why the HCI members believe it's important for our community to address this issue. Jefferson County suffers from high levels of obesity, tobacco use, drug abuse, and mental health issues. Rather than trying to address just a specific cause, such as tobacco use, diabetes, substance abuse, or mental health, we would like to address the issues of ACEs at the root source, or at the upstream, as we like to say, so that we can reduce these later life health issues. This is the ACEs pyramid and was included in the original study conducted by Felitti and Anda. It basically says that ACEs start with your family background, what you experience, and that it has a cumulative impact on your health and well-being throughout your life. It also shows that ACEs are intergenerational and that ACEs will be passed along to the next generation if not addressed. Let's take a look at ACEs in Indiana. These data are from a 2016 survey of children 18 and younger. Parent divorce is the ACE experienced by most children in Indiana and is higher than the U.S. average. Number 2 on the list is low income. Another area that experienced by over 10% of children is a parent who has served time in jail, which is also higher than the national rate. Mental illness, suicide is experienced at a higher rate also than the U.S. as a whole, and may be due to the stigma that seems to be higher in Indiana in talking about mental illness, and and as well as the many areas in the state, including Jefferson County, where there are fewer mental health provider resources. This slide demonstrates the current profile of children and youth in Jefferson County. It's not a direct comparison to the last slide, but it is the best attempt to show the adversity faced by children in our county. Notice that we have a much higher child abuse and neglect rate than the state of Indiana at almost twice the rate. The percentage of single parent families is high and higher than the state rate, as is children in poverty. Our kids are experiencing ACEs now, today. It shows up in our schools when children act out and are disciplined, when they don't complete homework, and then when they turn to drugs or alcohol to ease the pain in their home life. The state of Indiana recently released a study of ACEs in Indiana adults. This is based on the Behavioral Risks Factor Surveillance Survey conducted in 2018. This shows that almost a third of Hoosier adults come from a family that experienced parental separation and divorce. In other words, almost 1/3 of all Hoosier adults suffer from at least one adverse childhood experience. Almost as high are those who suffered from emotional abuse or substance abuse in the household. It is possible that a third of all Hoosiers suffer from 3 or more ACEs. By this time, you must be thinking, this is pretty depressing. It is, but all is not lost. There are some mantras within the ACEs awareness community. Those are, ACEs are not your destiny. This means that although you may have experienced one ACE or all 10, it does not mean you are doomed to a shortened life of despair. What is predictable is preventable. Since we know about ACEs and their impact on our future health and well-being, we can address it and find ways to prevent it from happening. We should not say, what's wrong with you, but instead say, what happened to you? There's nothing wrong with you, but the fact of the matter is something happened to you in your childhood that's causing you to behave in this manner or have these diseases. If we can identify and talk about what's happened to you, we can correct the behavior. Finally, the child may not remember, but the body remembers. As an adult, you may not remember the neglect or emotional abuse you suffered, or may not have realized the impact of a parent's substance abuse problem had on you, but your body retains that knowledge. The stress that you endured as a child dealing with these experiences is retained in your body. Doing things to overcome that stress helps to build the resilience to deal with that stress. The teeter-totter concept is helpful to the understanding of how to combat ACEs. ACEs are negative things that lead to negative outcomes in life. However, resilience, which are positive things, can, if there are enough positive factors, outweigh the negative consequences of ACEs. So how do we build resilience? There are 6 things that researchers recommend to build resilience. Those are regular exercise, healthy relationships, healthy thoughts, mindfulness, eating nutritiously, and proper sleep. Building resistance is important. This slide is a different way of looking at building resilience. And it's also recommended that if you have concerns about ACEs and how it might be impacting your life, that you talk to your physician for assistance. It's not only important that we raise awareness in individuals about ACEs and promote practices in our community to build resilience, but it's also important to develop policy and practices to prevent ACEs. Here are 6 policy considerations. Strengthen economic supports to families. This includes family-friendly work policies. In our community, this may take the form of figuring out how parents can leave work to address problems with their kids to address problems their kids are experiencing at school without the parent worrying that it will cost them their job. Change social norms to support parents and positive parenting. Ways to reframe the people think and talk about child abuse and neglect and who's responsible for preventing it. Provide quality care and education early in life. There's lots of research demonstrating the benefit of early education for kids. Affordable, quality preschools are needed so that all children have equal chance at education. Enhance parenting skills to promote healthy child development. There are programs in our community available for first-time parents, but there are conditions for qualifying to participate. A program for all first-time parents before and after birth would be helpful because kids do not come with an owner's manual, and YouTube does not have all the answers. Additionally, intervene to lessen harms and prevent future risks. Report that many children in our community do not see a doctor during those crucial years between being born and the start of kindergarten. Affordable health care would help. Reducing the stigma of mental illness and the opportunity to visit affordable therapists address this issue as well. Our community has a shortage of mental health providers, and insurance policies prevent barriers to accessing mental health care. The Centers for Disease Control affirm lessons learned by the Adverse Childhood Experiences study are a major concern. Based on national data, child abuse and neglect are more common than previously realized. Reports show that at least 1 in 7 children have experienced child abuse and/or neglect in the past year, and this is likely an underestimate. Research supports that children living in poverty experience more abuse and neglect, a finding that service providers must consider whenever they provide services. Rates of child abuse and neglect are 5 times higher for children in families with low socioeconomic status compared to children in families with higher socioeconomic status. So that's why that information earlier about what the socioeconomic status of kids in our community is so important. By raising awareness of trauma-informed concepts, communities will be better equipped to provide more equitable opportunities to children for whom these opportunities have been out of reach. CDC observes that child maltreatment is also very costly. In the United States, the total lifetime economic burden associated with child abuse and neglect was approximately $124 billion in 2008. This economic burden rivals the cost of other high-profile public health problems such as stroke and type 2 diabetes. If trauma is addressed throughout service providers becoming trauma-informed, these costs can likely be curtailed. Roos and others state that many cities across the nation consistently report growing numbers of those who are homeless. They found that adverse childhood experiences are substantially overrepresented in homeless population samples, and a history of childhood adversity and relate particularly poor outcomes among homeless individuals. Trauma-informed care training is an essential tool for service providers to better assist those who are homeless. I wanted to share with you this because not only are we experiencing homelessness in Jefferson County, but there are also a number of people, and one has to assume families, who are couch surfing. Couch surfers are people who do not have a home, but are not on the street either. They stay with family or friends for free, frequently moving so as not to burden those with whom they are staying with. This is just a brief presentation on ACEs. There are additional resources you can access to learn more. What many of us consider to be the real ACEs 101 is the movie Resilience, the biology of stress and the science of hope. It is not available on the internet, and we have shown it in the community several times. However, during COVID, it makes it difficult to do so. You can get a feel of what resilience looks like by clicking on the link from KBJR Films to see the bonus content from Resilience, as well as the movie Paper Tigers, which is about high school students. Dr. Nadine Burke-Harris, who we've got listed for her TED Talk, is also a real cheerleader for ACEs. In addition to watching her TED Talk, it's well worth the time to read her book, The Deepest Well. She does an excellent job of explaining the science of ACEs in an understandable format. The HCI, in partnership with the Community Foundation of Madison and Jefferson County, have teamed up to address ACEs in our community. A preliminary study has been conducted and a community initiative will be launched to address it. Watch the HCI Facebook page for information, and you can see our final report as well. We have the link for that. I want to leave you with this thought from Becky Haas, a nationally recognized speaker who has led ACEs efforts in Tennessee. Every city needs to examine how they are supporting the development of protective factors among children and adolescents in order for them to avoid behaviors that place them at risk for adverse health and educational outcomes. These factors increase an individual's ability to avoid adopting unhealthy coping skills and promote social and emotional competence to thrive in all aspects of life, now and in the future. These are references that were used to put together this presentation. And finally, we thank you for joining us. Please reach out to me at howardk@kdhmedicine.org with questions, or if you would like to be a part of building a resilient Jefferson County. We thank you for your time. Have a good day.